Go.
Today the skill we're focusing on is urinary catheterizations. Two types of catheterizations. What are they?
Intermittent and indwelling.
Okay, good. Straight, intermittent, or indwelling. We called Foley catheters for a long time, but now it's more typically called Foley insertion. All right, when you use a straight catheter and intermittent, for what purposes?
If they don't need constant drainage, so if they
Like what?
are paraplegic that uses a wheelchair.
Okay.
Intermittent, as much as you can to avoid the indwelling.
Okay, so specimens, okay, self-catheterizations, people who have neurogenic bladders and they cath themselves, maybe a post-void residual if you don't have a bladder scan machine. Okay, good. When do you insert a indwelling Foley? What circumstances?
When it's ordered.
Yes, when it's prescribed. But who would be prescribed an indwelling?
Somebody's about to have surgery.
Surgery's a big one. What else?
ICU patients.
Yep. People who are critically ill, people in the ER with trauma. Yep. Anybody else? Yep. Now, if somebody needs long-term drainage, what kind of catheter are you going to use? Suprapubic. Right. Suprapubic. Why?
Less infection rate.
Less infection rate. Okay, good, good, good. Now, if you do an indwelling Foley catheterization, there's two types. What are the two types?
Double, triple.
Nope, that's the differences in the catheters. Two types of insertions.
Male and female.
Good guess, but no, that is wrong. Open and closed. What's the difference between open and closed? Anybody? Okay, what are we doing today? What is your kit?
Oh, open and closed as in the appliance is attached to the tubing.
Yes. Okay, so a closed system in the kit, the catheter's already attached to the drainage bag. Why do we want to do that?
Less risk of infection.
Correct. Okay, but you still might see an open catheter insertion done. If that's true, you have your catheter kit, and then you need to get a drainage bag, and somewhere during the procedure you're going to connect the two. All right, so what we're using is the Dover silicone-coated latex Foley tray. Denise, can you catch? All right, is it a good kit to use? What are you looking for? Expiration date.
Fully sealed.
It is sealed.
It's sealed, it looks good. Okay, now, different companies make different kits, so you always have to read the instructions and make sure you have everything you need. So tell me what's in there, Denise. What's the expiration date?
9/30/2019. It's
We're
good for a
good.
couple of years.
All right, we're good to go. What's in there?
Silicone-coated latex Foley tray, 16 French 5 ml catheter, pre-connected closed system.
Okay. 16 French, good?
Yep.
Yep.
Okay, for a
Average
average
adult.
adult. So if we were going to cath a little kiddo, what size catheter would we use?
12.
Or, yeah, 10, 8s. It just depends on the age of the child. If you were cathing somebody who had hematuria and had a lot of blood clots, would you use the 16?
Mm-hmm.
No, you'd probably go 22, 24. Good. What else is in there?
Powder-free nitrile gloves,
Okay, and they're not good at all. Okay,
a CSR wrap,
okay. That's all right. I'll show you.
fenestrated drape.
Yep.
3 povidone iodine swab sticks,
Okay, for cleaning. Yep.
sterile lubricating jelly,
Mhm.
urine specimen vial,
Okay.
10 ml pre-filled syringe of sterile water,
Okay.
prep deck, tamper evidence seal, and a towel.
Okay. Anything else we need? Anybody?
Our own sterile gloves.
You might want to bring your own sterile gloves. These are not very good. So if your hands are exceptionally small or large, okay, if you have sensitivity, to powder, latex, whatever, you may want to bring your own. But we're going to try and use the ones in the kit.
Are there non-latex versions?
Probably, but there's so many different kits.
Okay.
What about
So
like some lidocaine or some numbing agent?
For males, Eddie will show you that later, but
Safe.
typically for a female, we don't.
And you're gonna clean
Yeah.
before you go sterile, so.
Yes,
Some sort of-
correct. So, we're gonna come into our patient's room. What's the first thing we're gonna do?
Swipe.
We're gonna
yourself.
swipe and explain everything. Yep, you guys know the routine. And then what are we gonna do?
Raise the bed.
Yeah, let's get our patient in position. What position are we gonna place our patient in?
Is it a male or female?
Yeah, it depends if it's male or female.
Okay, we're doing a female.
Dorsey
Okay,
women.
good. Now, depending upon your patient's size, your patient's level of consciousness, your patient's physical abilities, you probably won't be doing this alone. You're probably gonna need some assistance with supporting the legs, okay? You might need somebody with a flashlight to help you identify where the urinary meatus is. So the likelihood is you'll have a helper for this. But before we cath, you always want to provide hygiene care for two reasons, okay? Why are we gonna do perineal care before we do the actual catheterization?
Prevent infection.
Okay, we're gonna try and get rid of as many bugs as possible. What's the other reason it's helpful to do care?
Take a sample.
Not a
You
sample,
can
but take,
visually start to see where you're going.
yeah, it's a sneak preview. Okay, you want to be able to see if you can locate the urinary meatus. It's better to do it now while you're not sterile than later on. So it helps you do a pretty thorough assessment so you know what you're doing when you get all gloved up. Okay, I like to use the bath blanket for urinary catheterization, and I usually kind of make a square and I fold it like this. And then I have a little triangle where I can promote privacy as much as possible. All right, now your mannequins are a little stiff. So we're gonna do our best to position our patient before we get going on the actual procedure. Okay, Barb, you may wanna